Welcome to today's episode. We're excited to be interviewing one of the leading voices on food insecurity in the United States. She is an author, a keynote speaker, and CEO with more than 25 years of experience in anti-hunger work. In this episode, we'll dive into a critical topic: why simply handing out more food to those in need may not be the most effective and long-term solution. We'll also talk about the state of food pantries and how we can improve them. We'd like to welcome Katie Martin to our monthly podcast. Katie is the author of Reinventing Food Banks and Pantries, New Tools to End Hunger. She is also the CEO of More Than Food Consulting, LLC, which provides consulting services and technical assistance to help promote a paradigm shift in how we tackle the problem of hunger. So let's jump in. Katie, thank you so much for taking the time to be with us.
It's my pleasure. I really, really appreciate the work that you're doing with St. Vincent de Paul in your community and raising awareness through this podcast. So thank
Well,
you.
I'm just really I'm really interested in diving into this because the pantry that we have on our Shelby Park campus is so important to so many families within the 40203 zip code. So we're going to learn a lot as well from this. So I'd like to start off with kind of was there a specific moment, or is there a story or a background and how you focused your career on this really important work? Tell us a little bit about that, how you got to where you are today.
Yeah, thank you. I'd say going back, both of my parents had helping professions. So, they modeled a career to help others. So my dad was a psychologist, my mom was a nurse, so they modeled a lot of that. Yet I would say if there was a specific moment, I had an opportunity. I interned with my congressman, Tony Hall from Dayton, Ohio. I'm originally from Ohio, just right over the river from you all. Um, and he has been a lifelong advocate for anti-hunger work, both domestically and internationally. And spending time interning with him, and it was a summer internship during college. And it really focused my interest and attention on the preventable problem of hunger. And that shaped the trajectory of my graduate studies and my career. And I would say another moment that I would say influenced me, and it was many, many cumulative times spending in food pantries, but a day that I spent when I interned at the food bank for New York City, and one morning getting off the subway to go to visit a food pantry, there was a long line of people down the street waiting to get food. And the folks that received the food that day were very grateful for the food. They needed that food, but it was very transactional.
Hmm.
People waiting in line, volunteers, very well meaning, spending time bagging the food, handing the food to people on the street. And it struck me then, and it continues to strike me now, that there must be a better way to tackle this preventable problem of hunger in our wealthy society.
Got it. Yeah, no, and I know that, I mentioned the book Reinventing Food Banks and Pantries. It really dives into that. And in that book, which when I read it over the summer, you wrote that during the pandemic,
Yeah,
right?
yeah.
Yeah,
Well,
right.
at the tail end, I was
Yeah.
writing it before COVID hit, and I'm really grateful that I was still writing it when the pandemic started so I could touch upon some of those early lessons. Um, yeah,
Well, and I want to dive into that because I think it's important, especially with what we're seeing today in California with the wildfires and
yeah,
in the Carolinas and the
yeah,
eastern part of the states with the flooding and all the different natural disasters that put a lot of stress on a lot of families. And the importance of charitable food is certainly important in those situations. But you're in the book, though, you talk about reinventing the way that we provide charitable food in America. And in the book, and I recommend it for anybody, obviously that is, in the business of food banks and or just wanting to learn more about what's going on out there. Um, in the book, you talk about that it takes more than just providing food to end hunger in the U.S. Can you talk about what you mean by that? And yeah, let's dive into that a little bit because I think that's
Sure.
interesting.
Yeah, that was the rationale for when I started my consulting firm. I intentionally called it more than food consulting because it is my firm belief that it takes more than food to end hunger. And I mean a few things by that. Mostly, if we think historically, that in the United States, we have built this very robust national network of food banks and food pantries that serve every county in America. And we've done a really amazing job of collecting and distributing billions of pounds of food to millions of Americans for decades. And food banks and food pantries have grown in scope and scale and size over these decades, but we haven't solved the problem. In fact, we've become quite comfortable, and it's very normal to say that at least 10% of all US households experience food insecurity.
Mm,
And this goes back to data that we've been collecting since 1995. In my estimate, that's just not okay.
right.
And so, despite all of this great, important work that's happening within charitable food, handing out food and doing that efficiently is not solving the problem. So, when I say it takes more than food, it takes healthy food, it takes nutritious food, it takes providing that food with dignity so people don't feel humiliated if they need to get food. It means providing wraparound services to support people beyond just food, but connecting them to additional services like childcare, transportation, health insurance, employment, etc.
Mm.
And it's also about looking upstream at thinking about the kinds of policy changes that are necessary to really address the root causes of why it is that certain groups of people, particularly people of color, particularly single moms with kids, and other marginalized groups, are more at risk for food insecurity. That's not just an individual problem. That is not the fault of their own. Those are systemic inequalities that make it harder for these groups to make ends meet. So we're doing good work, but we can certainly do better. And at More Than Food Consulting, we talk a lot about the three C's of creating a welcoming culture, providing healthy choice, and making connections to other community resources. And those are some examples of providing more than just food.
Let's talk about that. The more than food consulting and there's coaches that you embed
Yeah,
and the best practice would be to have coaches embedded with, that are trained to be able to interview and
yeah,
understand the person's story. I think in the book you say, meet the customers, meet the guests where they are.
yeah,
One of the things that I'd like for you to talk a little bit about, um, in the work that we do at St. Vincent de Paul with our pantry and with our kitchen, and of course we have housing. We're housing around 300 folks a night on our campus. And one of the things that I've learned over the last 3 years in my time at St. Vincent de Paul is that a lot of folks find themselves unhoused because of many different systemic reasons. And to your point, the food insecurity, there's many different reasons why folks will find themselves in that situation. But one of the things that I've learned that I think is sometimes lost in the conversation is the notion of relational poverty and not having a support system and not, you know, for instance, in the when I have conversations with folks about our shelter and things. They say, well, you know, those that are on the street that are unhoused, they don't want to go in the shelter. I said, no, that's not true. They're just addicted. There's an addiction issue. There's a mental health issue. I said, when you really kind of step back and look at addiction and mental health challenges, yeah, a lot of the folks that we help do have those challenges, but so do housed individuals.
Yeah.
They
Yeah.
have relationships and they don't have relational poverty.
Yeah.
And so they're housed, but they have a mental health challenge, or they're housed, but they have addictions. I can imagine that what you're finding when you dig into these coaches dig into the why, you start to see that come out as well. That relational
Yeah.
poverty or the gaps that they have. Is that
Yeah.
true? Do you see that as
I
well?
Yeah, I love the way that you're framing this, and I totally agree. There's a few thoughts that come to my mind is I think it's a chicken or an egg scenario with mental health and addiction and poverty and food insecurity. Do those things come first and those lead to being unhoused and living on the street? Or when you're living in poverty and you're struggling and you're worrying about making ends meet, and then you become unhoused, is that what tips the scales to the mental health issues and the abuse and the substance abuse? So it's complicated. I've also been really uh, influenced recently by a great group in Columbus, Ohio called Community Development for All People. And they talk about radical hospitality. And to your point of, relational poverty, not having enough strong, meaningful relationships and folks in your life that are looking out and caring for you. The notion of like, how do we create a welcoming culture that's really dignified when someone comes in, just greeting them, looking them in the eye, saying, "How are you doing today? I see you. I see you, and I welcome you exactly as you are today." I think that's the nature of radical hospitality. It's not about my needs or, the convenience of our volunteers, but really looking out for the guests that are coming in and loving on them exactly as they are today. And as you mentioned, our coaching initiative, it's along the lines of our third C of connection, of when we recognize that folks who are coming in to get food, the food is just the tip of the iceberg, that often folks are struggling with other basic needs and other developmental needs. So how do we greet them, meet them where they are, and building those relationships, and over time saying, what brings you here today? What else is going on in your life? That takes time, that takes some relationship, but also then trying to connect folks with other existing services within your community. So St. Vincent de Paul is doing a beautiful job with the work that you're doing with food and with housing, which is incredible. There are all these other social service providers and nonprofits in Greater Louisville that are also serving probably the same clientele. How do we make it easier for folks when they're coming in for food to also know about these other services that can be provided? So that can be having volunteers that are knowledgeable about those other resources and programs, sharing information about eligibility requirements. Where do you go to apply? What do you need to bring? What days are they open? That's what we would consider a warm referral. You're helping to refer folks really warmly, intentionally, with detailed information. And then the coaching program is a little bit more intensive, where we meet with folks to set goals over a longer stretch of time.
I read that you all put you in collaboration with another individual, you pulled together a guide
Yeah,
to offering more than food in pantries. Can you talk about the guide and how folks can? It's free, I think, right? You can just
it's
download it.
free. It's
Yeah,
free. And I'm
yeah.
really, really thrilled about that. Yeah, this was a few years in the making, and it's with my really strong colleague, my collaboration with Jessica Sanderson from Urban Alliance, which is based in East Hartford, Connecticut. Jess is a wonderful human being. Urban Alliance is a faith-based service provider, and Jess and I have been working over probably about over a decade now, of building the notion of these three C's and what does it mean to offer more than food. And so if you go to our website, you can download the guide, and it provides a background in why this is important, what are the values behind it, and then how you can implement some of these better practices within a food pantry.
Yeah, no, that's great. And again, I really recommend our listeners to just go ahead and Google, um, more than food, and it'll come up, and you'll see the guide, and you can
Yeah,
download it.
our website is
It's
it
real easy
takes
to get
more
to
than
it.
food.
What is it? Say it again.
It takes more than
It takes,
food.org.
got it. It's real easy to get access to all that, and I couldn't agree with you more about just the importance of being able to direct folks to different resources, like you're talking about. And uh, recently I went on a new board here in town, and I want to get your thoughts on this. Kind of coming out from left field here because I'm just thinking about
Yeah,
the connection in the community for individuals, and some of the reasons why folks find themselves at risk, from a food insecurity perspective. But the board that I went on is called Thrive by Five. And so it's a new initiative in Louisville to essentially create access for all families that want access to pre-K
yeah,
and childcare centers. I can imagine that as you dig down into the why folks find themselves in the situation that they're in, is that they don't have access
yeah,
to quality pre-K childcare, and it feeds into the systemic issues associated with why individuals find themselves, unfortunately, food insecure, not
right.
having access to something like that. So I could
Yeah,
see that being a community resource that these coaches could direct
absolutely.
people to, right?
Absolutely. Well, one of the things that we talk about is, as you're building relationships with folks that come in and you understand that, here's a mom coming in with young kids. First thing that comes to my mind is the WIC program. Are you familiar with WIC? If not, let's help you enroll in WIC. What are other, programs and services that may be beneficial for a mom with young kids? How do we connect you with diapers, with
Yeah.
other, the basic things that we need to thrive? And we know there's such a strong connection between nutrition and cognition. So we know that when kids, especially the youngest, that birth to two is so critical in brain development. And when kids don't have all of the nutritional needs that they have met, that sets them up for a lifetime of, challenges. So those early years for kids are so critical. And so how do we, surround young families with the care that they need? And also thinking about, policies and things like the child tax credit
Mm.
that was put into place during COVID. So, I mean, it basically cut the child poverty rate in half. So, yes, we need to focus on individuals and look upstream at policy changes and, like the impact that our government can have to make a huge
Well,
difference for
it,
families.
it reduced homelessness, family homelessness as well. Now we're seeing that trending
Yeah.
back up.
Yeah.
And the HUD just released their point in time numbers, and homelessness has increased, unfortunately, 18%. And lots of different reasons for that.
Yeah.
But the demand on organizations like St. Vincent de Paul is it's overwhelming, actually,
Yeah.
because the ends never meet. And I
Right.
can imagine, I mean, we're blessed to have a pantry that is solely volunteer run.
Hmm.
There isn't any full-time employment there. It's all volunteers. And they mainly come from a lot of the parishes in the archdiocese, and have been doing it for years and years and years. So can't wait for them to see this podcast and get them access to the guide. And there's ways for us to do things maybe differently, going forward. But clearly, the long-term benefits of healthy food, and the book really touches on that, right? That
Yeah.
because without that, And without the access to pantries, folks are going to gravitate towards probably really unhealthy choices.
Yeah. Yeah, there's so much data and evidence about the connection between hunger and health. Um, and that is both physical health and mental health. And there's, really strong evidence that if you're struggling with food insecurity, you have disproportionately high rates of chronic diseases such as diabetes, type 2 diabetes, hypertension, obesity, but also anxiety, depression, mental health disorders. So it's so important. And there's a lot of movement nationally for food banks and pantries to promote healthy food. There's a really great resource called the Healthy Eating Research Nutrition Guidelines, or HER, that help to break down and make it easier to understand which foods we should choose often, choose sometimes, choose rarely. Um, so that's a great resource. Fresh produce is something that we know neighbors and guests that come to food pantries are asking for. They want more fresh produce. They don't want more canned food, even though we often do canned food drives. So a lot of emphasis on how do we build the capacity of food pantries to have refrigeration, to have shelving, to be able to handle fresh produce and make it accessible to those who need it.
Yeah, when I first got to St. Vincent de Paul, one of the challenges that the volunteers brought to me was that um, the pantry's open on Tuesdays and Thursdays, and if you get a shipment of fresh produce on Wednesday and you don't use it all on Thursday, you want it for the next Tuesday when folks
Right.
come back in, but it would spoil over the weekend because there wasn't enough refrigeration. And so
Right.
guess what the volunteers did? They raised the money for a new fridge,
Love it.
a
I love it.
walk-in, a walk-in fridge, right?
Yeah. Yeah.
And so now we don't have that problem. But without that support,
Right.
uh, we wouldn't have been able to do that.
Yeah. And, I think part of that building the capacity is, and I definitely want to touch upon the role of food banks and the really strong partnership that you have with Dare to Care, um, is linking these issues together with your fundraising appeals, your ask for donors, is when you make the connection between hunger and health and you talk about your emphasis on healthy, nutritious food, and it costs more money, it takes more resources, you need refrigeration, and yet you're therefore not just addressing basic needs, but you are doing disease prevention, health promotion. You can invite different types of funders to the table and different partners in this work.
Yeah, we've worked hard. And the relationship with Dare to Care is amazing. Vincent James at Dare to Care is doing amazing work. Other partners like Kroger,
Yeah,
uh, and now Publix is coming into the market here.
good.
They've opened up a number of stores, and so we're hopeful of that partnership growing as well. But to your point, um, it's really important to make sure that we do have those healthy choices for folks. One of the things that unfortunately COVID, we were a choice pantry prior to COVID, and uh, went to bagging
Yep,
and doing all that during COVID and haven't gone back to the choice. What is the talk about? Because you talk about that in the book about,
I do.
the assembling the volunteers assembling and taking the time to put all that together and again, we're serving so many people and it's a blessing that we're doing it. But the choice side, what does that mean for
Yeah,
folks to have a choice pantry? And can you describe for our listeners what a choice
yeah,
pantry, what that
happy to.
means?
Yeah, happy to. Thank you. So often when we think about choice at a pantry, we think either or. Either you pre-bag food where everyone gets the same food, or you offer choice. And in my experience visiting lots and lots of food pantries around the country, it's more nuanced than that. So we've been working hard to define four different levels of choice. So there's no choice where you pre-bag. We all went to that during COVID. We had to for public health precautions, and we did a really great job of getting food to folks. limited choices where you maybe get to choose between two different types of bags of food, or everyone gets the same bag. And then there's a few limited items that folks can choose from, kind of a miscellaneous or perishables. Modified choice is pretty popular. That's where maybe you have neighbors fill out a menu where they can select, yes, I want soup, I want cereal, I want chicken instead of beef. They're kind of like categories of food. And then the volunteers will go prepare that food or go around the wall. Or sometimes it's even that guests are pointing, they can see the food, but the volunteer is picking it up and putting it in the bag.
Got it.
What we call full choice is, you can think of it in a perfect scenario is where it's set up like a grocery store where people can walk through with a cart. Um, but most importantly, it's where they can select and handle and touch the food themselves. And why is this important? Because it matters, because it really, really matters. The relationships that we can get with folks, like that radical hospitality. I don't know about you, but if I go to the grocery store and somebody handed me a bag of food, I might like the convenience of it, but there's a very good chance that there's food items in there that I don't want, other family members might not want. That can lead to food waste, which we're, very keen on trying to reduce. Um, it just makes so much of a difference. And speaking of Dare to Care, we've been partnering with Feeding America, the national organization based out of Chicago, and a whole host of food banks, including Dare to Care, over the last 3 years. And Dare to Care was just such a champion for this work. And I am just really impressed with the work that they're doing. And Vincent James is a great colleague. Um, we've done some really great research on the benefits of offering choice. And what we find is when food pantries increase choice, and especially when you're offering that full choice with dignity, it's a better experience for volunteers and for staff. It's a better experience for neighbors, most importantly, for those who are shopping for their food. It reduces food waste because guess what? People are choosing the food that they know that they're going to eat at home. In a nutshell, it's just a really, really better way to offer food. One of the myths that I hear a lot from folks is we don't have enough time, we don't have enough space, we don't have enough volunteers to offer choice. And from our research, working with many food pantries around the country, conducting really rigorous research with a group out of the University of Chicago called NORC, and Feeding America, we find that any sized food pantry and any staffed pantry, whether you're all volunteer or you have paid staff, are able to offer choice up to and including full choice, and it makes a difference. So I would encourage anyone listening, and especially your team. We know that we had to take choice away during COVID. This is a great opportunity to start rolling it back in. You can pilot it. You can do it on certain days of the week. We have a lot of great resources and tools and action planning kits to help you think through the steps of increasing choice. But it really starts with the mentality of understanding the value that it can have for the people that you serve.
Are those tools part of this guide that we talked about
Yep,
earlier?
there's
Is that
there's a lot of
it's
great there's a
embedded
lot
in
of great
there?
work there. Yep. And then we have some additional resources too.
Yeah, that's great. So, talk a little bit about more than food consulting, and if you can, and maybe you don't name a specific pantry by name, but can, talk to some success stories that you've had that where you've kind of gone in. And when we were getting introduced before we started the podcast, you asked me kind of what my background was. So my background's in consulting as well. So you kind
Yeah.
of come in and you're there to, you know, to take organizations to a different place, right? You're here
Yeah.
today and you're going to be here when you're done. What are some of the success stories that you've had out there in the work that you do to help pantries?
Yeah, it's a great question. And I'm smiling because I feel really fortunate. We have so many success stories.
Yeah.
So, yeah, and I'd say our mission at More Than Food is to advance organizational and systems change within the charitable food network to make sure that people have nutrition and economic security. So we do a lot of trainings and resources and technical assistance and webinars and peer learning sessions for that organizational change. So folks will often read my book, come to us and say, we read about this, we want to learn more, we're ready, we think we're ready. So there are folks that are ready to dig deeper with their volunteers and become more trauma informed,
Mm.
to get more volunteer training, to reduce their wait times. They come to us because they want to increase the amount of healthy, nutritious food that they're offering and do nudges for more healthy food. They come to us because they want to offer warm referrals or start a coaching program. They want to evaluate their work differently. They want to do a strategic plan. So I have a very robust gratitude practice where I have conversations like this, and I feel so blessed and fortunate to be able to hear stories of what folks are doing and then share that with others. So you asked for a success story, and one that does come to mind is a really, really great food pantry in Paterson, New Jersey called CUMAC. It's CUMAC.org. And they've been around for a number of years, but they've really bought into so many of these changes. And they have a healthy choice marketplace where folks sign up by appointment so they don't have to wait a long time. They have SNAP navigators that help enroll folks in SNAP and other benefits. They do a lot of training with their staff and volunteers to become trauma informed, and they embed that in so much of the work that they do. So when we think about that, building that relational piece, going back to the beginning of our
Mhm.
conversation of like recognizing that when folks are coming into a food pantry, they likely have experienced some type of trauma. How do we become more knowledgeable about that so that we don't cause more harm? And then we can really help there and be them in relationship with them. They have community conversations and on and on. So I would say they've really taken a lot of the lessons that I wrote about in my book, and they're bringing it to life. So that's just a really cool example. But there are so many others, and we have a monthly newsletter that we put out, and we typically highlight a success story every month.
Mm.
So there's a lot of ways to hear what's going on.
So are there with um was it Kumac?
Kumac.
Kumac. Are there metrics that they look to determine are they on the right track? I mean, or did you help them with defining metrics? And I mean, right now for us, the key metric is how many folks are we serving,
Yeah, yeah,
right? And that's a metric, right? How many and who are they? Are they families? Are they individuals? Veterans? We've got all
yeah.
the numbers and all that kind of stuff. But what other key metrics are you seeing out there that are important to the success of
Yeah.
a pantry?
Yeah, it's a great question, and I'm finding there are more folks that want to move from outputs to outcomes,
Right,
and like
right.
moving from just pounds to people. Um, so a few examples, and there are many, but one that I think is a relatively easy one is most every food pantry and food bank will talk about the number of pounds of food that they distribute. So layering within that like some additional metric about the health and nutritional quality of that. So an easy one there is start with fresh produce. Like what percent of your overall pounds are fresh produce? That's like layering in a little bit there. Um, in terms of the kinds of services that you're providing, so at St. Vincent de Paul, you're doing amazing work with housing, and you've got case managers that are working with folks and helping them. Um, as you offer some of those wraparound services, even first identifying, what are some of the challenges that folks that you're serving are experiencing? What percentage of your families are experiencing type 2 diabetes or high blood pressure, which leads into the importance for those fresh pounds of produce? How many of them are interested in receiving additional services for SNAP, WIC, childcare, transportation, et cetera? And then over time, measuring how many folks have you helped to enroll in health insurance or, affordable housing, et cetera. Some additional metrics that you can look at. I often caution folks steer away from the generic satisfaction questions. A lot of folks will say, we ask for feedback and we'll ask, how satisfied are you with getting food at our pantry? Shocking. 99% of folks say they're very satisfied with getting the food. It's not a great question because people need the food. They're very grateful for that. But you can layer in, are there food items that you're receiving that aren't super helpful, or what other types of food would you like to see here at the pantry? And then tracking that over time of like, how are you doing with sourcing that either through your food bank or with other donors like Kroger? Um, it's helpful when you think about the types of changes you want to make. So let's say you want to start introducing choice back into your pantry, or you want to extend some warm referrals. When you're ready to make those changes, asking for some feedback from your guests, specifically for those changes that you want to make, and then sharing those metrics back with folks. So there's a great flyer that we recommend from a food bank in Missouri that's called We Heard You. So when you ask for feedback, share that back. Hey, we heard that you want more protein, that you want more meat. We're working on that, that we're trying to get more eggs. We know that eggs are really expensive right now, but we're doing our best to try to get more eggs into the pantry. Or we heard that you want some extended hours that are more convenient for you. We're going to try to pilot some evening or weekend hours. Those are just a few examples.
Yeah, no, those are great, and the outcomes are important. On the housing side of things, we got all sorts of metrics, right?
Yeah.
And things that will dictate whether or not we're on the right path for success. And the pantry, to your point, when you're able to get to the more than food approach to things, I can imagine. It's interesting if you were to look at our campus and the number of folks that come through there, and again, there's lots of trauma that folks have been through, their why and why they're there, their story. They're all different, but it's a place where other providers of services that they need can come there. Meaning, our city now is the city of Louisville is embarking on a community cares campus where it's going to be very similar to what we're doing, where it's comprehensive, it's focused on families. There's going to be respite care. There's going to be food,
That's
the
amazing.
pantry, and when you do that, it's kind of like, look, we're not a recovery center. We don't provide recovery. We don't do job training. We don't do these things, but we have the ability to. There's access to folks that need those things
And
right there
probably
on our
there are other
campus.
groups in your community that do offer those services.
They do, right? So they're right there, right? And so let's build more of these comprehensive providers of services like that can then draw in those that do those things
Yeah,
that our guests need.
absolutely. Yeah, make it more of a
Uh,
one-stop shop.
Well, the pantry is a perfect place for something like that, right? Uh,
Absolutely.
more so, I think, even than um, we've got a commercial kitchen that's doing about 10,000 meals a month, but a lot of those folks, they're in, they're out. They're in, or sometimes they just carry out kind of
Yeah.
thing. Um, so yeah, no, I can see the benefit of the more than food. How do folks, I mean, what does that look like in terms, and again, I come from the world of consulting and having engagements and, you know, relationships and all that kind of stuff. How does that work for if a pantry, wants to engage with the more than food consulting? How do they go about doing that? I mean, and then what does that look like?
Yeah,
Is there a fee for services? And I can imagine that there is. How does
we
that
do.
work?
Yeah, we do. We try to meet agencies where they are. So we do have a fee for service model. We have an engagement. If you go on our website, it takes more than food.org. You can contact us for information. Um, and we offer a lot of free resources too. So we have a free webinar series every other month where we talk about uh, best practices and we highlight great work. We have a free newsletter. We have a free More Than Food guide. And then when folks want to dig deeper and have more time with us, then yeah, we work with you to figure out what your needs are and how we can support you. So it varies from, you know, very short term, like an hourly basis type of technical assistance to multi-year projects where we work with large organizations like food banks and other
Right.
partners.
Right. Yeah. And I'm glad that you've had experience in working with Dare to Care
They're awesome.
here in Louisville. They really are. And when I was at Ernst and Young and my prior career, we spent a lot of time helping Dare to Care. It's a great organization.
Yeah, my colleague Mallory McGalliard, who works with me, she had the opportunity to go visit during our project with Feeding America and these food banks to promote choice. And she came back just raving about the whole team at Dare to Care. So they're an amazing group with the leadership, starting from the top, but all the way through. It's a really great group.
No doubt. And when you look at the history of why it exists, the story behind why it exists, and it stems back to a time when a young person on the street died of hunger on Thanksgiving.
Oh, wow. I didn't know that.
So there's a story, and it's
Yeah.
and it's very compelling story to say never again,
Yeah. Yep.
never. And we say never again, but even in a country of and I've traveled all over the world. I've been
Yep.
blessed with a career that took me to many different places. And, it's just unacceptable to be in a nation where there's so much abundance, but yet
That's
there's
right.
still folks on the street, yet there's still folks that are food insecure. It's just not,
Exactly.
it's not acceptable.
It's not okay. Yeah. And one of the themes in my book is that we're doing really good work and we can do better. We
No
just
doubt.
shouldn't accept having this level of hunger in our country. And we know things that work. During COVID, the government stepped in and made it easier for folks to enroll in federal food assistance programs. They put moratoriums on evictions and student loans. They passed the child tax credit. All of these things worked.
Yeah.
And then we rolled them back. And now we have higher rates of food insecurity, housing insecurity, mental health issues. We know the things that work. We just need the political will to put them into
Well,
place.
I for one will download the guide and take a look at that and have a conversation with some of the folks, some of the volunteers that we have that run the pantry. They've been doing it for a long time. One of the
Yeah.
things I learned is whatever they need, get it for them.
Yeah.
You know, whatever it is. And they're just wonderful humans, and I think they would embrace this guide and think about different ways that we can kind of move forward. I mean, actually having coaches in the pantry would be a big, big shift.
Yeah.
That
But
would be
you
a
can
big
start
shift.
smaller too.
Yeah.
You should be so proud of the work that you're doing. You're
Yes,
really
absolutely.
making a difference. So, kudos to you and your whole team. And, a lot of what we talk about in the More Than Food Guide, in my book, in the work that we do at More Than Food Consulting is take one step. There are a lot of like small steps that you can take. Try not to get intimidated, just get started.
Yeah. Just move. Just do it.
Yeah. Yeah.
Right. Katie, thank you for taking the time to be with us today and sharing. And say again the website that folks can go to.
It takes more than food.org.
Takesmorethanfood.org. Katie, you're doing amazing work. You're saving lives. You're giving hope. It's very important work. And God bless you. And thank you for taking the time to be with us.
Thank you. It's been such a pleasure meeting you and thank you.
Okay. Take care.
Bye-bye.